Water flossing versus string flossing, which is better? When it comes to cleaning between your teeth, you've got lots of options, whether a water flosser, string flosser, go-between, toothpicks, there's so many options. I'm here to help you kind of figure out what those options are and which ones are beneficial. Hi, I'm Dr. Brett Langston. I'm a prosthodontist, and I'm the Director of Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia. And I'm here to help you watch your mouth. So the first most basic type of cleaning in between your teeth is your typical string flosses. These are usually made of a nylon filament, and they're basically, you take one, wrap it around your fingers, and you go between the teeth. So a lot of times people have their heart in the right place when they floss. They go between the teeth and they feel like they really need to push up and violently get in between the teeth like this. And a lot of times that's great because it can dislodge some particles, but when you're pushing up and going directly between the teeth that hard, you can lacerate the tissue, you can cause damage, and you can cause that really thin tissue to bleed. And a lot of times that's why gums bleed, is because people are doing it too aggressively and pushing right up between the teeth when that's not really necessary. All you need to do is a nice gentle pressure to go between the contact. And then you just go and hug each tooth, so you're kind of scalloping the side of the tooth, and that's gonna be enough to kind of clean everything. And then you just go gently around the mouth. Flossing does not have to be a traumatic incident. It can be very relieving because you're cleaning everything out, and if you go slow, take your time with a nice pressure to get through those contacts instead of the violent shove, you're gonna find you enjoy flossing a lot more. There's wax floss, there's unwaxed floss, there's mint flavored floss, there's cinnamon flavored floss, there's unflavored floss. You've got a lot of options, and at the end of the day, you really just need to pick the one that's right for you. I would stay away from some of the flavored ones if possible, because a lot of times they can irritate the gum tissue worse because of the materials on there to give it that flavor. But having said that, if flavored floss is the only way you're gonna floss, go for it. There's also an option of something called dental tape, which is a little bit thicker, a little bit kind of has more beef to it, and it does a really good job of getting in between teeth if they have kind of a little bit more open contacts. And again, whichever one works for you is totally fine with us. As for me, I prefer a wax floss because it glides between the teeth better. Sometimes we can see with unwaxed floss, to get it between those contacts, you have to put some pressure, and sometimes that can lead to kind of pushing a little too hard like we showed earlier. A lot of our patients have limited dexterity. You know, the ability to kind of wrap the floss around your fingers and get into all your little areas way back there can be tricky, especially if you've got arthritis, if you've got other issues going on. And there are lots of items on the market that can help with that. There's floss holders that actually are kind of semicircular shaped, have a piece of floss that you can hold a handle. It's very easy to use that. A lot of things you can find in the grocery store or the pharmacy. So flossing is pretty straightforward when you have individual teeth. One of the problems when you have bridges or attached crowns is you can't floss directly between the teeth. So in order to do that, we have a couple solutions. One of them is something called a Proxy Soft, which is basically also called Super Floss. Lots of different brands, but basically it's a piece of floss with a really hard end on it. And so you can use it to kind of get in between the gum tissue and the fake tooth, and then you can floss and pull it out. Another option is a floss threader, which basically looks like a sewing needle. You floss your floss through, and then you can use this to get in between the teeth, and then you pull it through and you can floss. And these are great options when you can't go directly between the teeth because they're attached like a bridge. Other options for getting in between teeth, we have things called Proxa brushes or TP brushes, which are basically bristle brushes that you can go in between, especially if you've got bigger spaces between the teeth. A lot of patients that have bone loss or periodontal disease, that tissue's pulled back, and so you've got these black triangles that are bigger than just floss would just kind of bounce around in there. So these do a great job of getting in there, cleaning everything, stimulating the tissue, and kind of making sure you have no debris left behind. We have gum stimulators, which are basically rubber tips so you can get in there and get in between those teeth. We've got kind of miniature toothbrushes. You can do an at-home version, or we've got these for you as well, that basically are just a little tiny focused bristle that gets right in between there. So like I said, you've got lots of options. And if you have any questions about whether something is safe to use, whether something is okay to use, absolutely shoot me an email, come by the office, we'd love to talk to you. A water flosser. So basically what this is, it's a high-powered water jet that you can go around all the teeth, and it does a phenomenal job of getting in all the nooks and crannies. I do like to warn my patients, though, it's kind of like having a fire hose go off in your mouth, so be prepared. I wouldn't use it on your Sunday best. A lot of times I tell patients now they have a wireless model. Do it in the shower. It makes a mess. You're going to get lots of stuff out of there. It does a phenomenal job. The other advantage of these is that in addition to cleaning out debris, they really stimulate the gum tissue. And also, unless you put it on super high and get really close, you're not going to damage your tissues. And stimulating the gum tissue is a great thing because healthy tissue stays adapted to the teeth and it stays adapted down, and it prevents bacteria and food particles from getting into pockets and causing further bone loss. The third option that you have for cleaning out in between the teeth in areas where a toothbrush doesn't reach is mouth rinse. Mouth rinse actually surprisingly does a really good job of getting into all those other little spaces that you can't quite reach with a toothbrush. There are lots of brands, Listerine, Crest, all the major companies make one. And now on the market, there are lots of different options. So, Listerine is popular and it has that typical Listerine burn. It's because it has alcohol in it. And so if you have a situation where you don't want alcohol or the burn is too intense, there are other options now. Listerine makes a non-alcohol. There's a couple brands. I think Act makes a brand that has no alcohol in it as well. And they come in a variety of flavors. They all basically do the same thing. Some of them have a little bit of antimicrobial purpose to kind of clean the teeth, but the main purpose is the swishing and the swirling and the moving around of the liquid gets in and dislodges and knocks all those little tiny particles off your teeth. Why do I need to floss? I do a good job of brushing. And while brushing is great for removing the majority of debris and plaque and bacteria buildup on your teeth, you're only getting about 85% of your tooth surface when you brush. You're getting all the surfaces on the outside, on the chewing surfaces, and on the inside, but the areas you're missing are the areas right in between. And so what floss does is it gets in there in those little tiny spots and clears out the decay, the potential decay, and clears out the bacteria from in between those teeth. We'd love for you to brush and floss twice a day. I realize that's a pretty lofty goal. If you floss at least once a day, that does a really good job of kind of keeping everything cleared out. Cleaning your teeth properly at home is the first step in maintaining a healthy mouth. However, I highly recommend maintaining a good 6-month recall, so that way we can come in, check your teeth, check your mouth, make sure everything is clean, healthy, cancer screening, everything we can do to make sure you're not missing or overlooking anything. Until next time, I'm Dr. Brett Langston, helping you watch your mouth.